Hi everyone, my name's Abbie Tipler and I'm one of the surgeons at Veterinary Specialist Services. Today we're going to be chatting a little bit about the checklist and how it can be used in your own practices to reduce the risk of complications. So I hope you enjoy this talk. It can be found in the vet resource area of our website, which is vss.net.au. So we'll get started talking about checklists and I'll chat with you soon.
So where did checklists come from? Well, in 1935, the US Army Corps were test flying a Boeing Model 299 using two highly experienced Army pilots. And after takeoff, the plane began to climb, but within seconds it stalled and crashed to the ground. And it's not a story with a happy ending, and a simple yet fatal mistake had been made by highly experienced personnel, leaving a control in the locked position. So it was basically human error that led to this disaster. They deliberated on the cause of the crash, and they nearly actually decided that the plane model was just too complicated for pilots to fly. And in a media article at the time, they described it as too much plane for one man, despite this plane being in all other respects the best model. However, what they actually ended up concluding was that there were just too many steps for a person's memory. And if they put these steps into a checklist, that they wouldn't have this problem. So 4 checklists were initially developed for this model of Boeing. There was takeoff, flight, before landing and after landing, and it went on to fly 2 million miles without incident. And the checklist idea was so successful that it enabled aviation and aeronautical engineering to become more complex, and checklists were developed for more components of the flight, including what to do in an emergency. And then a man called Atul Gawande, who was a renowned human surgeon, devised a simple surgical checklist for use in operating theatres. It was implemented in 8 hospitals, and the average reduction rate of complications was 36%, and it cut deaths in half. There has since been a lot written about checklists, including the excellent book that I've read called The Checklist Manifesto, amongst many others. And there's been a huge plethora of literature proving the success of implementing checklists in the small animal world. However, slightly disappointingly, there has been resistance to their use, and not using a checklist is still a common factor in accident reports. So how can we use a checklist in our practice to reduce the risk of complications and probably also stress levels? One of the key things they found about checklists is that they should not be designed to necessarily be a list of every last thing, but to include the smaller range of things that might be error traps for disaster, and I'll give some examples in a moment. And there are a couple of different surgical checklists that we use across our practices, and although they might be just slightly different, they have things in common which I'll discuss as we go through how to create a surgical checklist. And we're more than happy to send anyone copies of the checklists that we use, and they're here. And a surgical checklist is best if it's individually created for your practice, but they do have some key components which we'll discuss now. So a surgical checklist generally has a sign-in component, and this is completed pre-induction to ensure that you have the correct patient, there's no known allergies or risks for intubation. We also at this stage identify if the patient is a blood loss risk, so we can assure that we have blood on hand if required. We check our anesthesia and monitoring equipment has been checked. We note down the antibiotic protocol, and we give the patient an ASA grade, which is an assessment of the anesthetic risk. And although this is the general design for the sign-in part of the surgical checklist, you can really create your own specifics, and this applies to all parts of the checklist. So for example, if you are working in a shelter situation and desexing a number of patients in a day, you may want to check the sex of the patient or the microchip details prior to induction. And I guess always just go back to complications that you've encountered in the past, and then how to prevent these from happening again with a checklist. So secondly, we have what is generally called timeout, and this is the period of time post-draping but prior to incision. And when devising your checklist, think about the factors that would be disastrous to the patient. So, i.e. the sterility of the instruments has not been confirmed, you perform the procedure on the incorrect limb, you don't have the equipment that you need during the procedure, or you leave a swab in the patient. And these are the things that we check off at this stage of the procedure. And we also have a few additional ones added here, such as is the essential imaging displayed? Can we please have an estimate of blood loss, etc. But you can modify your checklist to suit your own practice. And then finally, sign out is your chance to check your plan for recovery, note down any anesthetic complications, equipment failures so that they can be rectified prior to the next surgery, any recovery concerns, record your swab count, and finally check your pathology is labelled and not left on the tray or thrown into the bin. And you can use all sorts of different checklists. There are checklists for abdominal explorations to remind you on what checks you need to do and what samples to take. There are equipment checklists. I've always thought that a euthanasia checklist would be a good one, just to give you peace of mind when you're doing your euthanasias. And again, we're more than happy to send you this checklist for exploratory celiotomy, which is up there on the screen. So in summary, checklists are free, yet they reduce complications and patient morbidity, they increase practice standards, they help to make things run more smoothly, and they increase your level of patient care.